that 10 essential commodities received fewer than 4. Today, that rate stands at 95%. We restored the authority's balance sheet by recapitalizing KEMSA through a 10 billion shilling credit facility arranged with one of our commercial financial institutions. And we did that because there's no supply chain in the world that functions without working capital. We have operationalized the Embakasi Supply Chain Center. We have strengthened our regional distribution hubs in Kisumu and Mombasa. And we have moved the entire chain from paper to platform. Your Excellency, today KEMSA supplies more than 11,400 health facilities, and 54% of everything it distributes goes to primary health care at level 2 and level 3, the dispensaries and the health centers, where most Kenyans seek care. What this means for an ordinary Kenyan, Your Excellency, is very simple. The mother who walks to a dispensary with a prescription in her hand now finds the medicine at the end of the queue, and not a referral to a chemist she cannot afford. On National Equipment Support Program, equipment, Your Excellency, because a clinician without a diagnostic is a clinician guessing. Under the National Equipment Support Program that you introduced as one of the key pillars of universal health coverage, as of 30th July 2026, we have installed medical equipment valued at 9.68 billion shillings in 251 health facilities across our 44 counties, showing 239 county facilities and 8 national facilities. Let me be very specific about what that means at the bedside. It means 36 CT scans, it means 2 MRI machines, it means 52 digital X-rays, and it means 72 ultrasound machines that have been provided. Consider what that changes. Not long ago, a Kenyan who needed a CT scan had 2 options: travel to Nairobi or go without a diagnosis. Today, that equipment is available in the great majority of our counties, and it's paid for by Taifa Care, not by the national government and not by our county governments. Over the last 4 years, this government has deployed 24,573 healthcare interns to all the 47 counties, Your Excellency, at an investment of 19 billion shillings. An annual placement has risen from 3,373 in the financial year 2022-2023 to 6,800 in 2026, nearly doubling the single admission for our young graduates from our colleges. This has allowed young Kenyans who for 4 years ago could have completed their training and go home to wait, get a placement. We have also sponsored 262 medical registrars across 35 specialties, so that counties who have never had a single specialist are now growing their own. We have released 3.5 billion shillings to settle the accrued basic salary arrears owed to our doctors. Under your direction, we are employing 5,000 additional nurses and midwives are being recruited. All these happened under your leadership, Your Excellency, in the last 4, and we will showcase them as the 2-day health summit progresses. Your Excellency, allow me now finally to acknowledge our partners in this work. To our Excellencies, the governors, health is a devolved function, and every figure that will be quoted in this hall was earned in a county facility by a county staff. This reform has been a genuine partnership between the 2 levels of government, and I want to thank our governors for that. To our development partners who have stood with us, Kenya, through a very difficult period of global health financing, thank you for the confidence you have shown in our healthcare system. To our private and faith-based providers, our professional bodies, our unions, you are inside this system, not outside. And this reform is stronger for your involvement. And to the Kenyan healthcare workers who are here and those who are listening to us, who are the reason any of this, who are the reasons that a patient reaches them at any time. This government sees you. Tomorrow, this summit devotes an entire plenary to your future. Over the next 2 days, Your Excellency, we will do an examination of our healthcare financing, primary health care and community health, human resource for health, health products and technologies, health security, digitization of the healthcare system, and our specialized and referral services. Her Excellency, the First Lady, will do a session tomorrow on maternal and newborn health at the plenary. We will have the Deputy President who will run another plenary tomorrow afternoon before we have a joint plenary where we want to listen to the people of Kenya, and His Excellency the President, as a listening leader, will be sitting in that forum. Your Excellency, just to conclude, tonight we have the Town Hall Health Summit. And we want to answer all the questions. We want to answer all the questions concerning the healthcare system in Kenya. We want to answer all the fake headlines for 4 hours. Because as I said, we had a plan, and now we are presenting the record so that the people of Kenya can compare what we promised, what we planned, and what we have delivered as of now. To Your Excellency, and more important, is in that healthcare at a Health Summit Town Hall tonight, we will have testimonials from the stakeholders, what our unions see in terms of healthcare workforce reform, our patients, professional associations like Kenya Medical Association, and many others. Our governors will be there. The entire leadership of the counties will be there. But Your Excellency, just to answer some of the basic questions that we have been asked, is that the architecture of universal health coverage, at the bottom is the primary health care, which is fully funded by your government. 27 billion in the last 2 financial years. 19 billion in this financial year. Why do we invest in primary health care? We invest in primary health care because 70% of the disease burden in our country is at the primary health care. And Your Excellency, with those many, many remarks, it's my honor and duty to invite the Speaker of the National Assembly to come and give us remarks on the role of the legislature in the delivery of healthcare system in our country.
Your Excellency, the President and Commander-in-Chief of our Defense Forces,